From WREL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Monday, August 3rd, 2020. I'm Cliff Baumgartner. Here's the latest from WREL.com. The University of North Carolina at Chapel Hill has launched a coronavirus dashboard to keep the college community updated on data related to the coronavirus. On the resource, students can see how much personal protective equipment is available and how many positive identified cases of the virus there are in the community. And for some students living on campus, this resource has left them wondering if coming back might not be worth it. The dashboard shows that as of Saturday, more than 100 students tested positive for coronavirus since March. A total of 10% of student tests have come back positive. The university is not planning on testing every student before their return to campus. A statement from the school said that it is not recommended by the Centers for Disease Control and Prevention. A statement on the school's website said, quote, "The CDC does not recommend widespread asymptomatic testing and instead recommends that all individuals take preventative measures to reduce the spread of the COVID-19 virus. This is consistent with the advice of our own infectious disease and public health faculty experts," end quote. For students planning to live on campus, 96.5% of isolation housing is currently available for those who have tested positive or presumed to be positive based on their symptoms. There's 93.7% of quarantine housing currently available for those who have been exposed but not yet diagnosed. The statement also said that students who need to quarantine and isolate will get care from campus health and guidance on where they can safely do so. Those who live off campus may not need to leave their homes so long as they have their own bedroom and their own bathroom. Where that is not an option, on-campus isolation housing is possible. The school said on the website that the dashboard will help the university make decisions based off their coronavirus responsibilities. Many students began moving back to campus today. Their first day of classes is next Monday, August 10th. Today, Wake County announced a plan to help residents keep the lights on, the water running, and other utility services active. The county will provide residents who qualify with up to $500 per household to pay past due balances on utility bills for electricity, natural gas, water, wastewater, and solid waste services. Wake County Board of Commissioners Chairman Greg Ford said of the program, quote, "No one should have to go without water at a time when hand washing is so critically important, and no one should have to go without air conditioning when the heat index is in the triple digits." To qualify for Wake County utility relief, applicants must demonstrate financial suffering due to COVID-19, provide copies of past due utility bills from March 1st, 2020 or later, and demonstrate their household income is no higher than $39,540 for an individual or $56,460 for a family of four. The county is applying $5 million in federal money to start the program and expects to help at least 10,000 families. On Sunday, Duke announced that the Duke Human Vaccine Institute was given approval for a clinical trial that, if effective, could advance COVID care until a vaccine can be developed. The approval means the DHVI can launch Phase 1 of the clinical trial for one of the most promising antibody treatments for COVID-19. Duke says the treatment would be temporary, filling the gap until the vaccine is widely available. The DHVI is also developing a pan-coronavirus vaccine to combat future iterations of COVID-19 or similar viruses, as well as if saliva could be used as an indicator for COVID-19. That's according to Duke Today. A video released by Duke Health Development provides a deeper look into the trials and potential for the antibody treatment. You can find a link to that on our website. And lastly, a new program designed to help people who need to quarantine during the pandemic could help stabilize North Carolina's growing coronavirus caseload or even move it in a downward trend. The program targets the counties with the highest levels of the virus and will use about $17 million in federal relief money to help people who can't afford to isolate. Most of the 20 counties in the new support program, which the State Department of Health and Human Services hopes to have operational after Labor Day, are in the eastern half of the state. They include Durham, Chatham, Granville, Johnston, Lee, Sampson, Vance, Wilson, and Wayne counties. State Health Director Dr. Betsy Tilson said public health workers are tracing the contacts of infected people and asking them to stay home. But many at-risk workers don't have sick leave or any other way to pay the rent. But starting in September, low-income workers infected with or exposed to coronavirus can get some financial help, such as a one-time cash payment to help with housing and utilities, as well as home delivery of groceries and medication. Recipients have to have been asked to quarantine or isolate and must agree to do that. They will then get referred to the program through healthcare providers. Tilson said the program will be a big help in controlling outbreaks among lower-income workers. This has been your Coronavirus North Carolina News Brief for Monday, August 3rd, 2020. If you like the information and resources you get from this show, let us know. Leave a rating and review wherever it is you listen. Plus, while you're there, don't forget to hit subscribe so you don't miss our latest episodes. We'll be back on Wednesday. Thanks for listening.